MasterCare EMR, powered by Global Health. Unit 010S, Key Terms and Concepts. MasterCare EMR is a powerful electronic medical record system that tracks and manages the many complex interactions that occur between your health practice and your clients. Sometimes a system of this type is referred to as an EHR for Electronic Health Record. We call it an EMR, but for all intents and purposes, they're the same thing. There are many other interchangeable terms that are used throughout the medical industry, so in this short video, we're going to look at some of the key terms that we use in MasterCare EMR. The health industry and MasterCare EMR exist for the benefits of individual people. Do we call those people patients or clients? That is a decision that is up to your practice and the people you see. Within MasterCare EMR, we refer to them as clients. If in your practice you use the term patient, that's fine. They're the same thing within the system. But when they appear on the screen, they'll be referred to as client. When a client visits your practice, there are multiple people they could potentially see. A GP, a psychologist, a speech therapist, a pathologist, and on and on. When it is appropriate, we will specifically identify and address all of those specialties. But in the first instance, everyone who works at the practice is a member of staff. MasterCare EMR connects clients to staff. Clients and staff can connect at any time for a consultation. Any such meeting, phone call, or other form of connection is recorded in MasterCare EMR as an occasion of service. Multiple consultations will result in multiple occasions of service being recorded for that client. The client can also see different staff members at different occasions of service. At the moment, these could all be perceived as random individual occasions of service for that client. Ideally, we want a holistic view of the client's medical activities, so we need to be able to organise this information in a logical way to chart the client's progress. Additionally, in most practices, there are funding protocols to consider. For example, you cannot claim Medicare without a doctor's referral. MasterCare EMR provides all the facilities to enable these processes to occur consistently and efficiently. MasterCare EMR adds 2 additional layers of organisation to the system to facilitate the management of this data. Firstly, we have the concept of episodes of care. An episode of care is a period of health care that has a defined start and end. That is, an episode of care is measured from the first encounter with a healthcare provider through to the completion of the last encounter with a healthcare provider for this particular issue. For example, all the appointments associated with a single referral would relate to one episode of care. For longer, complex episodes, it may be necessary to further break them down into episode events. Episode events can break up the episode into distinct time periods. Episode events are also called reason for collection. Some organisations may refer to them as phase of treatment. These might be surgery, followed by bed care, followed by in-house physio. Next, we have the concepts of teams. The client may need to be seen by multiple practitioners. Those practitioners need to keep each other informed of the client's progress, and they are all working on the same presented issue. Each of those practitioners or staff need to be working on the same team. MasterCare EMR allows for the establishment of multiple teams. For management reporting purposes, each team will be reported on separately. For client care purposes, All care occurs within one team. The recommended workflow for when a client approaches your practice with a new referral is as follows. Create an episode of care for that client. Assign that episode of care to a specific team. Establish the various episode events. For example, they may be admission, discharge, and review. Schedule occasions of service for episodes of care or the episode event. And allocate staff from that team to the occasion of service. It may be that there are multiple episode events, phases of care, within that episode of care. For example, surgery, bed rest, and speech therapy. Each phase of care will be identified within the episode of care. All clinical notes for your occasion of service will be associated with the relevant episode event or the episode of care. Using MasterCare EMR, your staff will be working as part of a team, not just in theory, but in constant practice. All information entered or created by one team member is available for all. Occasions of service records all of the clinical details of a client-clinician consultation. Information is grouped according to the episode event or the episode of care. And everything is organised to present the clearest picture possible of and for the client. MasterCare EMR, connecting your staff to your clients.